Hi, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of McCauley, and I'm a proud sponsor of PetAbility. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At McCauley, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With McCauley, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them PetAbility sent you.
So you have to have the right frequency, the right type of metal. It has to be a weighted tuning fork, and the vibration clears the fascia.
Welcome to PetAbility. I'm your host, Kathy Simon, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Good afternoon, my friend. How are you doing over there, Kathy?
Good afternoon, Chris. Well, we have had a day over here.
Do tell.
Mac broke his tooth.
What?
Broke his tooth. Oh, I know, it was so upsetting. He wasn't upset by it, but I was like, what is in your mouth? What are you doing?
or not in your mouth.
And he broke off a piece of his upper premolar. Thankfully, I work at a practice where I was like, I have an emergency. You got coming right in. And he broke off a piece of his tooth. So we're working through that. Looks like he's going to be okay. So the listeners shouldn't worry. It was just a piece of that, and that tooth is going to be, the other rest of the tooth is okay. But my goodness.
Is it painful?
It was, I think, until it broke. And then he was back. Yeah. And then he was like, I'm feeling much better now. Thank you. But he's okay. He's okay. And we're okay.
Good.
But,
well, I know he could be a little melodramatic, so I'm glad he's turned a corner.
A tad. Yeah, a tad. So in any case, we have got a wonderful show today. We have one of our favorite returning guests, Dr. Laurie McCauley. And we're going to be literally tuning in to explore a fascinating and natural way to help our dogs move better and feel better with tuning fork therapy, or what they call acoustic therapy. Acoustic therapy is the use of sound to support pain relief and mobility. And it's a natural, non-invasive approach that works with your pet's nervous system and energy pathways to stimulate healing from within. And I'm so excited about this topic, and I have such immense respect for pioneers like Dr. Laurie, which she said we could call her Dr. Laurie. It's thanks to her dedication and her curiosity and her willingness to challenge the norm. Practitioners like me are able to do the work that we do today. Her contribution here laid the foundation for integrative healing to become more accepted, more acceptable, and effective. And as a clinician who specializes in hospice care, I work with a very fragile population of animals. And for this reason, I am always seeking out gentle, non-invasive techniques. And having treatment options like this are both effective and soothing. It allows me to provide care that honors the animal's comfort and dignity, but also enhances their emotional well-being. So I'm really interested to hear what Dr. Laurie has to say about the healing effects of sound waves and how they affect muscle and nerves and fascia, and as well as the emotional benefits to a patient and the pet parent.
Welcome to PetAbility, Dr. McCauley.
Thank you.
Let's get to it. Yeah. So Kathy mentioned you've pioneered so many integrative therapies for pets. And so what sparked your interest in sound or acoustic therapy specifically?
So I'm always learning and I'm always a bit crazy. And I was out hiking with a neighbor who is a dear friend, and we had our packs and our sticks, and we're up in the mountains, and we've seen one person after about 5 miles of hiking, and I slipped and fell and I broke my fibula.
Oh, no.
It was a mile and a half down on top of a mountain. You know, we're not talking about like cement now, we're talking about like roots and things we're climbing over. I went down the mountain 6 inches at a time going, all right, God, can't put any weight on my foot. Obviously, you're going to teach me something. Teach me something that's going to help the dogs. And went to the doctor. Yes, it's broken. It turned out to be very, very swollen. And I'm a rehab vet, right? So I did laser, I did CO2, I did PEMF, I did icing, I did massage, I went to physical therapy, they did manual therapy, they did everything they could. And they said, Laurie, I know you want it to go away. It's going to take a year to a year and a half to go away. And I'm like, that is not acceptable. And then I went to, because things in my life happen for a reason, I went to a class in osteopathy out in Eugene, Oregon with Patrice Corticus, full spectrum canine therapy. And I respect her so much. And took a tuning fork and she said, we're going to talk about lymphatics. Laurie's a friend of mine and we're going to fix her. And she said, I am going to clear your lymphatics. And in 72 hours, 80% of the swelling will be gone. And within 3 weeks, the rest of it will be gone. And I'm thinking, it's a tuning fork. Okay. And 72 hours later, 80% of the swelling was gone. And within 3 weeks, the rest of it was gone. And I said, I need to know more about that. So I've gone to more classes. I have talked to other people. And because I can't just do what I'm told, I've been using it with everything I can to see what it works for. And it's amazing. And then I did the research of, okay, what is happening when I do this? I did an extensive lit search and they use it for hearing in humans. And it does so much more.
Is it the vibration of the tuning fork that is working with the nervous system? Can you explain that a little bit more?
Absolutely. It's 128 hertz and it's a high quality tuning fork. So, tuning forks are expensive. And I went and I bought one on Etsy to see, and it did nothing, right? So you have to have the right frequency, the right type of metal. It has to be a weighted tuning fork. And the vibration is a vibration of fascia. And fascia, I mean, that's a whole discussion that we'll get into in a second, but it's the vibration clears the fascia. Can I get into that a little bit?
Yeah.
Yes, please.
Okay. So think about fascia like a spider's web, right? It's long, there's lines, it moves, it allows things in the bodies to slide and glide. It allows fluid to go through it, right? So our inflammation and stuff goes through it and goes to the lymph and goes away. And then imagine somebody taking sour cream and pouring it on top of that spider's web and then having it congealing and getting tighter and stickier. It's what I call sticky icky. So fat infiltrates it, inflammatory cells infiltrate it. The fibrocytes, the cells that help make this beautiful structure can't do what they need to do. They can't communicate with each other. And things just don't move. Fascia is literally around every cell. And when I say that, like they have electron microscopy showing that it goes into every cell in the body, into the nucleus. It touches the nucleus in multiple places in every cell in the body. Now let's take our telescope out a little bit, which means that when it gets sticky icky, it contracts around blood vessels, so there's less blood flow. It contracts around lymph vessels, so there's less lymph flow to be able to pull the edema out or any swelling out. So think about you go running and your knee hurts and there's a little bit of swelling around there, maybe a little bit of inflammation, you're gonna have a headache, all right? Oh, that's inflammation in the brain. The lymph is what pulls all that inflammation out. And when the lymph vessels are sticky, icky, smashed together, it can't do that. And the body struggles. Every muscle cell has fascia around it. So they can't contract all the way. They can't stretch all the way. Every nerve has it around it. So there's less information going back and forth because the nerves themselves can create discomfort or they cannot function as well. So it can decrease function. And then you go into all your organs, right? There's around the kidneys, around the liver, around the diaphragm, around the lungs, everything. Think about scar tissue and how scar tissue contracts, right? We can break all of that up with sound, which is amazing.
And you have often called fascia the forgotten organ.
Mhm.
And I learned a lot about this from when I took your class, Fascinating Fascia, which was great. So if people want to go back to Dr. Laurie's Optimum Pet Vitality, you can go to that course. And ever since I took that, I was thinking, gosh, it's so undertreated. I should be incorporating this in just about every one of my patients. I should be addressing the fascia because it's connected to everything.
To summarize, acoustic therapy that is delivered via very special, unique tuning fork specifically treats the fascia, which in turn affects everything else.
Yeah.
Function better.
Yes.
So I think it's good to make a point here in saying that, with anything out there, speaking to our pet parents specifically, there's so much propaganda and misinformation and such on the internet that when you explore different things, whether it's a supplement or red light therapy or a tuning fork, make sure that you're getting one that has been tried and true, tested and recommended by a professional. Like you said, when you got your first tuning fork, it didn't work.
Absolutely.
And then is the tuning fork different for human versus animal or species of animal, or does that frequency of fascia carry through to all mammals, let's say?
Tissue is tissue, right? Whether it be scar tissue is scar tissue, muscle tissue is muscle tissue, brain tissue is brain tissue, blood vessels are blood vessels, which is why you can take a heart valve out of a pig and put it into a human. So not only can you use it for the tissue, you can use it for horses, cats, dogs. My cats love it. They melt. But I've seen people use it with frogs, just the sound, the vibration, and have them
Frogs.
Frogs.
I
Yes.
probably like that. I can see frogs liking that.
Are these pet frogs?
Yeah. They're frogs, like, come to it. It's crazy. It's cool.
Yeah, frogs are cool.
So then to that point, investment in one tuning fork will suffice for everything.
So I know that this tuning fork is the frequency of fascia and it works for fascia. So there are theories out there that there's other tuning forks that work better on some different types of tissue. I'm experimenting with them. I don't have an answer on that yet.
Leave it to me to ask the
Good job,
tough
Chris.
questions.
And I certainly don't want to say somebody else said this because that's my reputation. I need to prove it to myself before I say yes. And I've tried it, blah, 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 blah. And this is what it works for. And this is what it doesn't work for.
Dr. Laurie, can you speak to the emotional aspect of using the tuning fork for patients? Because I'm always interested in the emotional life of my patients. And I think that this seems like it would be not only a very bonding experience for the owner and for the dog, but also probably a very calming, enjoyable experience for the patient.
Yeah. So this frequency actually, if you listen to it, turns on the parasympathetic nervous system, which is super, super cool. So for people who are not medical, your nervous system is broken down into multiple areas, and the autonomic nervous system, the part of your nervous system that is not necessarily controlled, is your like automation, automobile. Autonomic nervous system is broken into sympathetic, which is your flight, fight, freeze, fawn, or your parasympathetic, which is your rest and digest, right? It's your calming. So with this frequency, if you activate the tuning fork and listen to it, it helps you calm down. For my science people, because I am a nerd, it's the anterior cingulate cortex, part of the brain that's what we call your chatterbox, and it shuts it down so that you can relax and go to sleep. So whether it be just waking up in the middle of the night, whether it be, oh my gosh, I can't focus because I'm worried about blah, 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 you can shut that part of your brain down so that you can do what you need to do, whether it be sleep or focus. And it's with this frequency. And you can do it to yourself. You can do it to your pet. You can do it by having them listen to it, by just having it be around their head. You can do it by putting it on their body. And you see, I mean, I call it melting. Literally, they go from, I've had patients come in and they're stressed because it's something new and they're not sure what we're doing. You know, it's a new evaluation. And we start using the tuning fork and then they sit down and then they lay down and then they roll over on their side. And then their eyes look like they're stoned, like they're in half mass. And the owners are usually like, oh my God, what did you do to my dog? And can I do that at home?
Nothing is better than the melt, Dr. Laurie, when you have your patient just melt in front of you. I love that. And I kind of want to try it for myself now because my chatterbox goes on and on and on. So,
Kathy, do you think that this would work for your bird patients?
well, I think, first of all, I think for ducks, chickens, roosters, and fowl, I think absolutely. I think they would absolutely enjoy that. I think they would enjoy the sound, and I think they would enjoy the touch. Parrots are a little tougher because it's sometimes difficult to handle. But yeah, I think that if I could even just ring, have
Yeah,
the
the sound.
yeah,
That's what
the
I'm thinking.
sound for them, I think that may very well be calming for them. That would be wonderful. You know what? I'm going to see my friend Ozzy, the Amazon, on the 19th. Maybe I'll give that a go.
Yeah. Yeah.
You just helped me. I have 6 chickens.
I think they would like that. I think that
Oh, with this, I'm
chickens,
going to
yeah.
take this out to them and see if they like it.
Right. And I don't think chickens get enough credit for, one, their intelligence, but two, their emotional intelligence. And I think that if a chicken enjoyed having the tuning fork, the chicken would sit for it and the chicken might ask for it. I don't think they get enough credit for the sentient beings that they are. And I think they would respond really well to something like this. There's no contraindication, right, Dr.
Right.
Laurie? I mean, there's no contraindication to using it with any species.
So that's a perfect question. So everything is good in moderation, right? And there are times that you can't, I mean, the sound, absolutely, you can't hurt anybody with it. The touch of the vibration, one of the ways that in the human medical field they use it.
I know what you're going to say.
Is if you're like, I think it's fractured. I don't see a fracture on the radiograph. I don't know. We're going to put the tuning fork on it. Oh my God, the patient screamed. It's definitely fractured because the fragments vibrate separately and that puts pressure on the periosteum, which is where all the nerves are, which is the membrane around the bone, and it creates pain. We all learn, right? So I fell and I split my patella tendon and I thought, oh my gosh, there's inflammation. I'm going to put my tuning fork on it. And I did that for 1/100th of a second and went, oh my God, it's a torn tissue. It's just like bone. Don't do that. So I learned very quickly the hard way that you don't put it on something that you need to heal.
Yeah, that is interesting.
But scar tissue, it's fine because then the scar tissue, it helps it realign, but not when it's fresh.
Right, right. And I don't want like pet parents to be afraid because like you said, 1/100th of a second, you would know instantly. I mean, you're not doing any damage because it's so brief, but based on your pet's reaction, oh, not a good idea. We won't do that.
So let's jump into what are the most common conditions in the pet patient that acoustic therapy can help with?
Great question. So the number one thing I would say is trigger points, right? Tight muscles, muscles that don't stretch. I have a laser. I have a $35,000 laser and I reach for my tuning fork for that first because it's either as fast or sometimes even a little bit faster. It affects the Golgi tendon organs. So it releases the tension in that muscle so that the trigger point melts. And if it's you talked about a chronic issue, right? So if I have a tear of the muscle or a strain of the muscle, what happens is that the tissue around it melts. And then I feel that hard little spot in the middle. And I know that's where the actual injury is. So we use it for trigger points. Scar tissue. Oh my gosh. So again, I learned from experience, right? My dog, Sid, my heart dog, had to have emergency abdominal surgery. And I was in and out of town teaching, in and out. And his incision got infected and he had scar tissue. Now, this is a dog. He came to me and I said, you have straight knees, straight shoulders, a long back, You're not going to get a cruciate injury, a shoulder injury, a back injury. So he's on an exercise program, my ninja exercise program, not for everybody, but he can do bag stand bag 60 to 80 times. The dog couldn't stand up because the scar tissue in his abdomen would not stretch enough to allow him to come up fully on his back feet. I was devastated. I came into town, got rid of the infection, and the scar tissue was there. And I'm like, oh my God, what do I do? And I grabbed my regular tuning fork and I tried it and it was helping a little bit. And I'm like, oh my gosh, oh, wait, that's amethyst. When I went into the studies, they said that lapis is better for scar tissue. And would you believe in, I don't know, 6 minutes, 7 minutes, the scar tissue was organized enough that he could have full motion again? It was crazy.
And it's so restricting when it's around the abdomen like that. It's so restricting to everything, to all movement. And when you started the conversation, you were saying you reached for your tuning fork before you reached for your laser. Would you follow up with any other modality after the tuning fork? Would you then follow it up with laser, any type of exercise?
Absolutely. Nothing is ever a silver bullet. Nothing. Right. Right. You can't say amoxicillin, it's the wonder drug. It's going to take care of depression and make you lose weight. And it's an antibiotic and blah, blah, blah. Right. Nothing is 100%. So I do have a lot of tools in my toolbox. It's like building a house, right? You can't just have a screwdriver, even though a screwdriver is important. I have my tuning forks. I have my laser. I have my PEMF devices. I have my hands, right? Which is super, super important. I have my acupuncture, my chiropractic, my manual therapy, all of that stuff. So every patient is just a matter of what does this patient need today? And if you think about like acupuncture can increase the enzymatic stuff going on in the kidneys, right? And it can change things in the body that the tuning fork isn't going to touch, right? The laser's not going to touch. The laser, we know when you have arthritis in the joint, it's going to stop the cells that make the inflammatory mediators inside the cell that cause all the damage to the cartilage, and it'll, can turn on the cartilage cells to make more cartilage itself. Tuning fork's not going to touch that. So it's a matter of picking the tool, and most of the time it's multiple tools to have optimum effect for the pet.
Optimum pet vitality.
There you go.
That's right. 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 Good job, Chris.
Thank you. Putting in a plug for your business.
What do you say to the client who has the pet that's hypersensitive to touch? Can we condition that pet to the tuning fork?
So I have a patient right now, Jewel. I adore her. I adore her parents. That dad can touch and mom can touch sometimes. And when I did my evaluation with her, which is a 3-hour appointment, they were both jaw dropped because not only was she laying down, not standing, panting, shaking, we were able to roll her on her side and rub her belly. That's how much of a melt she had.
And I mentioned earlier in the podcast that I see a very fragile population of animals. And it seems like for patients who are at the end stage of their life, this seems like a really good tool to use, especially since they may not have so much mobility. They may not be able to engage in the exercises. They may need to be turned every 2 to 4 hours. It seems like this would be a wonderful tool for patients who are end stage of life.
Oh my gosh, you think about it. Why do they have to be turned every 2 to 4 hours? It's because they don't have enough perfusion. They don't have enough blood flow. They get swelling. The swelling causes all kinds of problems. Mm-hmm. This helps things move, right? You still have to move the muscles to get the blood to flow. Arteries have muscle that pushes blood flow along. Veins don't. So when you move, it helps the blood flow go around. But if the pressure builds up, you get edema, right? Fluid that has come out of the blood vessels into the tissue around the cells. And this helps the lymph flow take that fluid and dump it back into the blood supply where it belongs. Not only that, but it's not thousands of dollars.
Right.
It's something that pet parents can do at home.
That's so important. It is so important for the pet owner to be involved in their pet's care. And this is something that they can learn and do at home. When we're able to take the client and make them part of the pet's team, I think that's your best outcomes.
Absolutely.
And I want to get into that next. But before we do, back to Jewel then. I'm the summary gal today. So Kathy, I think, was kind of hedging when she was asking the question, with hypersensitive pets. You're actually saying that with those touch phobic animals, that this can allow enough relaxation and desensitization that they again melt. And so it's not noxious to them. It's actually relaxing to them.
So you start not touching them. You start by using the sound.
Mm-hmm.
If you play with one, when you activate the tuning fork, even just bringing it closer and further away has an effect on the ear, has an effect on your nervous system. There's techniques, there's things you can do that not only just is it a solid sound, but it's a change in sound that affects the brain as well. They get them used to it from further away, closer, closer, closer. And when they're comfortable with it, right? Because everything should be within their comfort zone. Then you touch them, and you don't touch them on the head, right? Because that's going to be kind of shocking. But you touch them on the back, right? So if you're not used to of doing medicine, and I know a lot of your listeners are pet parents, the reason vets used to give shots or still do give shots mostly right by the shoulders is because that's where they have the least number of nerve endings, so they feel it the least. And you can pick the skin up, and there's just a lot of space around there. And that's a great place to start using the tuning fork because it's like a gently brings them into it. It's kind of like if I took an ice pack, say you hurt your ankle, and I said, I'm going to put this ice cold freezing pack on your ankle, it would be shocking. But if I took a dishcloth and I put it in warm water and I wrapped it around the ice pack, you would first feel the warmth, and then it would slowly change to cool, cold, 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 and it wouldn't be shocking, and your system would allow it, and it would be so much more comfortable. It's the same with the tuning fork.
And how does that deep relaxation state affect healing?
So cortisol is what you release when you're stressed. And there's tons of studies that show that cortisol actually significantly slow down healing. So by being able to drop the cortisol in the body, right, which would be like corticosteroids, it allows the body to heal itself faster. And we're doing so much more than that. So yes, we're doing that with the sound and the parasympathetic nervous system, which is absolutely amazing. I love the parasympathetic nervous system and the vagus nerve. But again, we can get rid of the trigger points. We can free up the diaphragm so they can breathe easier. So there's more oxygen to get to the tissues to help it heal. We can increase the blood flow so that we have more blood flow to the area. If you have a dog that's on antibiotics, doesn't it make sense that if we increase blood flow to the area, we're increasing the antibiotics to the area so we can heal the infection? The body can fight the infection faster and stronger. There's just so many ways. We're getting rid of the pain. It's not, you cut your arm off, a tuning fork's not going to get rid of the pain. But for some things, when it's appropriate, it's amazing.
Can you do a little demo, Dr. Laurie? And
I would love
us what,
to.
yes, please. Show us what it looks like. Yeah.
And I'm also curious, when you do the demo, you were talking about all these things that it can help. Would you call this a direct technique once you're allowed to actually touch the tuning fork? In other words, I know you said like putting the tuning fork on that trigger point. If there's decreased blood flow in an area, are you trying to apply the tuning fork to the tissue that has less perfusion, or is it a more remote technique? I think more like acupuncture, acupressure that may stimulate a point that then affects something remotely. So maybe as you're demonstrating, you can talk about that.
Yeah, that's a great question. And the answer is yes, right? So just like in acupuncture, we use local points and distal points. It makes sense. Like say I have swelling in my ankle. I want to clear my thoracic duct, which is where all the lymph flow dumps into the subclavian vein, so into the blood vessels. Because if that's stuck, that's like putting a handle on the hose. If you have that nozzle on the hose and it's closed, it doesn't matter what you do lower down in the hose, you're not going to get that water to come out. But if you clear that, then the fluid can come, and you would want to clear the lymph nodes between the nozzle on the hose and where the injury is. So everything, right? Rather than having the beaver have the dam in the stream, you're clearing all those streams to have the most effect.
Again, I'm thinking pet parents out there are like, what? Subclavian, what? But you're going to talk about how you simplify things and make it accessible for pet parents too. So, yeah.
Oh, yeah, yeah.
For our listeners out there, you're going to want to go to YouTube to watch the demonstration that Dr. Laurie is going to do.
All right, you ready to play?
We're ready to play.
Okay, so many things, right? Here's the tuning fork. It, in this case, this has a weight, which is this part up here, which is what pushes the energy down to the end. Now, actually, I'm going to show you one without the tip. One of the reasons I don't like it without the tip, it's okay if you're treating an acupuncture point because you can literally stimulate the point, but sliding it, not very comfortable. With the course, it comes with a free tuning fork because I never want anyone to say what Dr. Laurie taught me didn't work. Well, if it didn't work, it's because it's a bad tuning fork, not because of what I taught you. So we give everybody a free, high quality, weighted tuning fork with the right frequency and with a amethyst tip, which is an amazing, it's like a healing stone. It's a general healer. It's good for many, many things. So we stimulate or we activate the tuning fork. You can listen to it. So putting it by my ear, I hear it. You can put it on acupuncture points to release beta endorphins. You can activate it and put it on a trigger point. One of the cool things is, and I teach my clients this too, is it's a diagnostic, meaning I can tell that there's a problem here tool, as well as a therapeutic, I can fix the problem here tool all in one. And I'm cheating, but I can't not, right? I have to show you how cool this is. So if I activate the tuning fork and I slide it on my hand, it slides really easy. Now, if I was going to treat, I'm going to show you where my thoracic duct is. It's right here. If I do that, I haven't done this in a little while. So I don't know if you can see this, but it's not going very easily. It's kind of stuck. And that's what we call sticky icky. So I obviously need to clear that area to allow the extra fluid to pour out there. You can, on your dog, use the tuning fork to find what's clear and what's sticky icky. And it's amazing because you can have a trigger point and you're like, it doesn't move and I'm going to treat it. And then I'm going to treat it. And now all of a sudden it's sliding everywhere. And that dog that's like, I can't move, all of a sudden can move all the way. Right. So it's a prove it to me thing.
Dr. Laurie, how does it move through a thick coat? So if I'm treating the Newfoundland, am I able to get down through that thick coat and be able to move it and glide it through that?
Yeah. It can.
Yeah.
You want to be at the right angle.
Yep.
Right. Angle is important because if you're just on the edge, you're not going to be able to feel as much. And if you're straight up and down, you're not going to be able to feel as much. So you want to be at the right angle to move it, but you'll definitely feel the difference between slide and glide and sticky icky.
Okay. All right.
And then I just want to show you what the lapis tip looks like. So it's a blue stone, and I'm a scientist. So when I first heard that lapis was good for scar tissue, I'm like, they're both rounded, they're both stones, I don't know. And one of the teachers, I lecture at, I do some locum work for LSU, the vet school. I go down there and I get to be head of the integrative medicine department here and there. And one of the teachers there that I was talking to, she studies stones, and she's like, Laurie, of course the vibration is going to go through somewhat different. They have a different hardness. They're made of different chemicals. I'm like, oh my God, that's right. Right? We all learn from each other. And that's why I have things like I was working with a dog and they had GI issues. And I'm like, okay, the amethyst is working a little bit. And then I'm like, oh, citrine's supposed to be good for the GI tract. Boom, cleared and gallbladder emptied. What? Yeah, it was super, super cool.
How long does it take, Dr. Laurie, or typically take before you see improvement in a patient?
Great question. I wake up in the morning and I'm like, oh, my neck is stiff, right? Or I've been sitting at the computer, but it's because I've been sitting there for a couple hours. I can activate the tuning fork and put it on my neck in 30 or 40 seconds. It's feeling better. If I have a trigger point, 30, 40, maybe 60 seconds. At AAVA, so the American Association of Veterinary Acupuncturists, I gave some lectures and I was explaining to people about it. And I worked with a woman who had significant arthritis in her hand. And I can't not teach. I can't not help, right? So she shows me this, and we were using the tuning fork on her wrist. And it probably took about 10 minutes, maybe 12 minutes. And she had like 30 degrees more motion in her wrist. 30 degrees more motion. She was shocked. She is amazed. I mean, she's like, it's been many years since I've been able to move my wrist like this. And to me, that is, why are we not using this in human medicine? I became friends with somebody, right? My life happens like crazy things. I'm going to get brochures actually for that conference. And somebody turns around and goes, "You're Laurie McCauley." And I'm like, "I don't know you." Okay. But I happened to notice that she had anatomy pictures of like the neck muscles. I'm like, "Oh, rectus capitis dorsalis. Oh my God, you speak my language." It turns out she teaches for Massage Envy. So I'm going to teach her about the tuning fork with hopes that she'll teach the people there on how to use this to help people. And then she's going to teach me whatever she knows and is the expert at, so I can use it to help people to work on dogs.
Speaking of teaching, Dr. Laurie, you have an online course for this. Can we get into that a little bit?
I would love to. So it's called Tuning Into Your Dog. Get it? It's 17 modules. So it's not super long. My modules are short because I study, right? Because I learn everything as much as I can. People learn better, are more engaged, and can remember things better if things are short. So it's 17 modules. It comes with a free tuning fork. It goes through the history of tuning forks. It goes through the anatomy you need to know. It goes through how to use it in many, many situations. We've had almost 400 people go through it since we started, and everybody is like, "Oh my God, this is amazing." Like I said, I've literally had veterinarians say, "This has changed how I practice." I had Heather Mack, who's a veterinarian, who called me as a consultant to help her dog. And of course, Jedi got better, which is great. And she said, "But I'm a horse vet. Can I use it with horses?" And I said, "Absolutely. Horses are so sensitive to energy." And her words like were music to my ears. She said, "I feel like I have a magic wand and I haven't gone through wizarding school yet." I'm like, "Oh my God, it just like so touched my heart." It's
That's
so
the greatest
cool.
line ever.
Yeah. So it's so cool. Yeah, the course is great. Like I said, it comes with a free tuning fork. It's not super expensive. You have it for a year. I hope that it changes medicine because it's an easy way to help so many inexpensively.
And I think we are evolving in veterinary medicine into more of these holistic, non-invasive treatments. I love that it changes the way we're thinking about the patient as a whole. I think one of the things in human medicine that you see is if you go to the doctor and you're like, "Oh, I have hand pain." They're like, "Well, you have to go to the hand doctor." "Well, I also have foot pain." "Well, now you got to go to the foot doctor." But I want to see the patient as a whole. You have to put it all together, the patient as a whole. And this is addressing that. So it's not just addressing their paw pain, it's addressing their entire body, their emotional well-being, their stability, their mobility, and their pain. So I love it.
Yeah. Can we take it one step further? Think about the dogs that they're kyphotic or roachy, right? Why is that? It's because the fascia around the muscles is pulling them into a position that's uncomfortable that then puts stress on their back and causes their back to hurt. Or they're sitting and their legs are straight out instead of being in the nice, correct posture so that it's easy to push off. All of that leads to more inflammation, and it's the inflammation that makes the fascia sticky, icky, and it's a cycle. And we can break that cycle. Think about people who walk with their back bent over, right? They literally have changes in posture because of their fascia, and fixing their fascia. I've done it. I was at an agility show, and we were talking about the tuning fork, and one of the ladies came and she's like, "My back is killing me." And I've been like this for a long time. And again, it took like 10, 15 minutes, but we were able to get her to stand up straight. Now now from there, it's her job to strengthen the muscles to keep her up straight. But we got her to be able to get there.
That was going to be one of my follow-up questions because you said that a typical treatment can be anywhere from seconds to minutes, but then how often does it need to be repeated, or does it?
Great question, right? So think about this. If you got an infection and you took one antibiotic, it would help and it may not take care of the whole thing, right? Yet if you cut yourself and you got an antibiotic and it stopped it right there, you'd be like, okay, I'm done, right? You put Neosporin on it or something like that. So if it's an acute thing, right? Oh, I wake up and my neck hurts, I fix it and it's done. If it's chronic, oh, it's been this way for 6 years. Actually, I shouldn't even say that because the lady with her wrist, and okay, I have to break in for a second. I had a lady that had an elbow. She was a tennis player, a competitive tennis player that had an injury that left her at a 90-degree angle. And in 20 years, she had gotten it to here. And in 10 minutes, we got her to here. Well, and for those of you who can't see, from 90 degrees to like, she probably had it at 60 degrees and we got it back to normal. So for those kinds of things, chronic, it's forever. But think about the dog who limps. It's not going to take care of a cruciate injury. It will help the pain associated with it and change the fascia with the back and everything like that. But if they continue to limp, that fascia is going to continue to have problems. And then you're going to need to do it again and again. And what I teach my clients is I fix them, you keep them fixed. And if it's an acute thing, it's done. Some of my patients, they do it once, our clients do it with their dogs, like once a week. Sometimes it's once a month. It's like, hey, I just go down their back and everything's fine. I don't have to worry about it. And instead of it being once a week, now I'm going to go to every 2 weeks. It's one of those things that we play with to see whatever the dog is doing to cause the problem. The more they do that, the more often you have to do it. Does that make sense?
Yes. And people are like that too. It's holding patterns, habits. Especially with people, we're often very, for example, right hand dominant. So, we're functioning asymmetrically all the time. So some of those things that we've learned over 60 years in my case, those are hard habits to break. But that's where the exercise comes in, and teaching the pet parent just even sometimes little things that they can do, maybe moving the food bowl or changing the sleeping surface or whatever that helps to augment the success of these modalities, such as the tuning fork, for more long-term benefit.
Yeah, absolutely.
Mm-hmm.
It's like you said, it's multimodal, right? We
yeah.
do everything to help to get optimum effect.
Dr. Laurie, how much is the coursework when you sign up?
It's $179, and that includes the tuning fork and includes the shipping.
A great value. Yeah.
$179 is very reasonable.
And if people want different stones, do they get those through you, or are they readily available?
Yeah.
Okay.
So it comes with again, let me grab the right one. It comes with the amethyst tip, which is the purple one. And then they can either purchase individual tips, and it's super easy. There's just a little screw that comes with an Allen wrench that you take that one off, put the next one on, or they can buy a bundle, and we have it that if you buy 6, you get the 7th one free, and then you have all of them. And like in the course, it tells you what each one is for, and then you can decide, okay, we're going to use this one, we're going to use that one. And if you're like, this is great, but I want a tuning fork for in the car and in the house or at at work or whatever, you can buy just the tuning fork, with the amethyst tip as well.
Do you get a discount for multiple tuning forks?
You can. So you can contact us. We do have multiple discounts, multiple fork discounts as well as the tip discount.
Wow. And, as we're, kind of wrapping up here, well, first, I want to make sure that you feel like we've covered, the highlights of acoustic therapy and so forth. But before we close, I also would love you to mention other courses that are available to, professionals and pet parents alike. And, I know both Kathy and I have tuned in to your webinars and things, and it's growing all the time. You're offering more and more and more and more. So if people aren't familiar with Optimum Pet Vitality, I'd love you to share more, please.
Absolutely. Thank you. So I love to teach. As I get older, I realize I'm not going to be around forever. So I want to help as many people, right? My mission is empowering people, optimizing pets. right? I want to help as many people be able to help as many pets as possible. So I started with the laser course. So I have both a professional laser course, which is race approved for 20 CEUs, so 20 hours. We have, which is optimum laser therapy. We have the pet parent laser course, which covers all of the joints, and that is at home laser therapy. Get it? You can do it at home.
Mhm.
Have the professional fascia course, which is Fascia 101, the forgotten organ. And then the pet parent fascia course, which is a simplified version, which is fascinating fascia. We have the cranial cruciate ligament course, the regular and the advanced course. So that is just for the professionals. We have tuning into your dog, which is the tuning fork course.
Is the tuning fork course a single course for both professionals and pet parents?
Yeah, I put it at a level that everyone would learn from. The exercise course is Confident Canine Care, a masterclass of exercise. So basically, any professional who wants to know, I need to know exercises. I do general practice, and I want to know the most important exercises that I can treat all my dogs. There's 24 exercises. It's Confident Canine Care. The pet parent part of that is Core and More, foundational exercises for your dog. And in both of those, it's the 24 exercises that literally will take you from a 16-week-old puppy to an adult to an athlete to a geriatric dog, because it has all of the levels and how to modify them. It has the red flags, what to look for, stop if you see this. It has the biomechanics for the human, because I don't want anybody to get hurt while doing exercises, how dogs cheat, how to outthink the dogs. I've put my heart and soul in all of these courses. So yeah, so those are my courses.
As a reminder for our audience, PetAbility, the courses that we've interviewed Laurie about, or the topics, I should say, that are relevant to these courses are Core and More, the exercises and such, and then also the fascinating fascia. And like you said, you have those both on a professional and a pet parent level. So yeah, it will be relevant for any listener out there.
And there's also Learn and Go, which are shorter, right?
Yeah, we have about 100 free videos on our website. So if you go to the website and you look at the top and you go to Learn and Go, you can click on it and just scroll through. There's all kinds of topics. Some of them, when I started, were a little more professional, like research articles and stuff like that. But there's things like, how do I choose the right size ball to exercise my dog? Hey, what's the difference in the shape of the brain of a pug versus a collie? And why is that important? And there's just all kinds of fun stuff, ways to help people help their pets.
It's obviously
Love it.
because the pug is a superior brain power.
Oh, geez, here we go.
That's what I would say.
But I really think that owners of pets out there, they are researching, they are interested, they are advocating, and they want to be empowered. So the more resources available, the better. And I also wanted to say that any listener who's interested in any of these courses, we are affiliated with OPV, Optimum Pet Vitality. And so when you sign up for a course, if you put in PetPod 22, capital PETPOD 22, then you will get a discount on the courses.
I've been teaching. I'm one of the instructors in VIN. So VIN is Veterinary Information Network. So there's over 60,000 veterinarians in it, and that's where they get a lot of their continuing education from. And I've been part of the team that has been teaching the pain management course. This is our 15th year doing it. And it's mostly drugs, right? It started out where Jan Huntingford and I had one of eight 2-hour lectures that was non-drug related. And in the 15 years, that has now gone to 3 2-hour lectures of non-drug related. So it tells you where people want to go. And when I originally came and said, I want to teach on laser, they said there's no research on it. And I said, here's 1,000 research articles. There's research. And they said, okay, you can teach on it. And then a few years later, I said, I want to teach on PEMF, pulse electromagnetic field therapy. And they said, there's no research on it. And I said, here's 100 research articles on it. And 2 years ago, I came to them and said, guys, I want to teach on something. And I have done an extensive lit search. And there is zero research on using this the way I'm using it. And it's amazing. And I thought they were going to shut me down. And they said, Laurie, if you believe it's amazing, not only do we want you to teach it, we want to learn from you.
And you're talking about the acoustic therapy?
Talking about using the tuning fork. Yeah.
Cool. Yeah. Well, we as rehabbers have come a long way in the last 30 years. And, I think the momentum is just growing as the years go on. And so, we're making a great collaboration, and everybody is out there to help everybody else and be a team to get those pets feeling their best.
Chris and Dr. Laurie and I were in the beginning of veterinary rehab. I was in the very first graduating class at the University of Tennessee. Chris was in that very first 100 of the
class number 3.
Class number 3. So we've seen it grown tremendously. And I love when we're able to incorporate things like this. It's just so simple too. And I think that pet owners shouldn't be intimidated to take this class because it's designed for them. It's designed for you. You're part of your pet's medical team. You're their advocate. This is something that you can do at home very simply and safely. So Dr. Laurie, it's always great to talk with you about all the new things that you're doing and bringing to the table. We should probably have Dr. Laurie as our third podcasting partner, Chris. We should just add her to the show.
We could just once a quarter, we could invite her,
just invite her,
back as a guest to
and,
share another little nugget. Yeah.
Right. And if you're the person who's the vet tech from 30 years ago, who somebody said, your friend is going to be Dr. Laurie McCauley, the mother of canine rehab, you're like, get out. No way. No way. And yet here we are. So it's always great to talk with you, Dr. Laurie. Thank you so much.
It's an honor to be here. Thank you for having me.
Yes, thank you. I'm always impressed and delighted, with your wisdom and passion, and you continually get me excited, about what we're doing and how we're all, influencing the lives of those around us. So thank you. And to our listeners, everything will be in the show notes, and thank you for listening. And until next time, take care of yourself and your pets.
Hi, PetAbility fans. This is your host, Kathy Simons. Do you live with a blind or visually impaired dog? Don't let vision loss stand in the way of a full, joyful life. In my book, Blind Devotion, Enhancing the Lives of Blind and Visually Impaired Dogs, I share my expertise and passion to help pet owners like you navigate life with a blind dog. From adapting your home to building trust and confidence, this book is your go-to resource for ensuring your furry friend thrives. Your dog's vision may be limited, but their potential isn't. Empower your dog. Get Blind Devotion today at Amazon.com.